Good morning, everyone. I am Dr. Madhav Sharan, and today I want to talk to you about something that quietly decides whether our patients walk out of Panacea healthier or harmed. Not a new drug, not a new machine. It's NABH Chapter 6 Patient Safety and Continuous Quality Improvement. For me, it's very simple. A mistake may happen once. NABH 6 exists so that the same mistake does not happen again and again. We are all human. Error is possible. But repeating the same error is a system failure, and that is what we are here to fix together. In the next 20 minutes, we'll explore three things. One, what patient safety really means in our day-to-day work. Two, how quality improvement actually saves lives beyond forms and files. Three, what your role is in this story, whether you wear a white coat, scrubs, a housekeeping apron, or sit at the front desk. Hashtag story hook, make it Panacea. Let me introduce you to a patient we see every day. Mr. Vama, 62 years old, walks into Panacea Hospital with chest pain. Follow him in your mind. Registration counter, first identity check. Emergency ECG, injections for line. Cath lab, maybe angioplasty. ICU monitoring, multiple medicines. Ward recovery, physiotherapy. Discharge, prescriptions, instructions. At every step, two invisible lines are running. One line of treatment decisions, procedures, prescriptions. Two line of safety, correct patient, correct drug, correct dose, no falls, no wrong side procedure, no missing documentation. If treatment is brilliant but safety is poor, we can still lose the patient. If safety is strong, we can rescue even a complicated clinical picture. So my definition of NABH 6 is we don't just treat disease at Panacea. We protect the person from our own system. Hashtag the Madhav Sharan formula. Measure, learn, improve. I like to summarize NABH 6 in 3 words you can remember. 1. Measure, don't guess. No. 2. Learn, don't hide, understand. 3. Improve, don't blame, change. Hashtag measure, numbers don't lie, we feel. Our hand hygiene is quite good. Falls rarely happen in our ward. Medication errors, almost never. Then we see the hand hygiene 40-50%. Falls 6-8 in a month. Multiple medication near misses. Suddenly, reality looks different. So we track indicators, falls, medication errors, infection rates, complaints. Not to shame anyone, but because numbers are not a report for NABH. Numbers are a mirror for Panacea. Hashtag incident reporting, from fear to courage. Now the uncomfortable part. Incident reporting. Many people think, if I report, I'll get blamed. Better to keep quiet than get into trouble. I want to clearly say, as medical director, at Panacea, reporting is an act of courage, not confession. Hashtag what should you report? Any patient fall, even if no fracture. Wrong drug dose route, whether it reached the patient or was caught just in time. Needle stick injuries. Near misses in OT, wrong side, almost marked, wrong implant, almost opened. Sample labeling issues. Equipment or oxygen issues that could harm a patient. Especially near misses. Why? A near miss is a gift. The patient was saved, but the system weakness is visible. If we ignore it, next time we may not be so lucky. Hashtag how we analyze the 5 style. Take a real type example. A wrong insulin dose was almost given. The nurse stopped just in time. Old style response, scold the nurse, file goes into personnel record. End of story. My style, NABH 6 style, we sit together and ask why. 1. Why was the wrong dose prepared? The order was misread. 2. Why misread? Handwriting unclear, dose cramped in margins. 3. Why unclear handwriting? It was a verbal order written later in a rush. 4. Why are verbal orders happening without checks? A policy exists but isn't being followed consistently. 5. Why not followed? Orientation incomplete, no hard stop for high alert drugs. Now the story changes. The villain is not the nurse. It is verbal orders, poor legibility, no double check system for insulin. So our solution becomes double check rule for insulin and other high alert drugs. Strict readback for verbal orders. Standard insulin order sheet. That is NABH 6 in action, and that is the culture I want at Panacea. Hashtag quality improvement, small experiments, big impact. Continuous quality improvement sounds heavy, but it's actually very practical. Think of PDSA like this. Plan, decide one problem you want to fix. Do, try one small change. Study, see if it helped. Act, keep it, tweak it, or drop it. Hashtag example from a ward falls we saw. 8 patient falls in 1 month, most at night, older patients going alone to the toilet. Plan, target, reduce to 3 falls per month in 3 months. Hypothesis, poor lighting, call bell out of reach, no structured grounding. Do 1 ward, 1 month pilot, night lights fixed. Call bell kept in hands reach and checked during rounds. Started 4P rounds, pain, potty, position, possessions every hour for high-risk patients. Non-slip footwear provided. Study, after 1 month, falls dropped from 8 to 4. Staff said, patients were calling more, falling less. Some still tried to walk without calling. Footwear stock sometimes ran out. ACT, adopt for P rounding and night lights for all wards. Adapt, ensure steady stock of non-slip slippers. Extra education to patients and families. This is not theory. This is how we prevent fractures, surgeries, ICU stays, and sometimes deaths. That is the true face of NABH 6. Hashtag everyone in the script speak to each group. I want each of you to see where you fit in this story. Hashtag doctors, when you do a stroke, sepsis or AMI audit, you are doing NABH 6. When you follow antibiotic policy, you are protecting the next generation from resistance. When you participate honestly in root cause analysis, you send a message that safety is non-negotiable. In modern medicine, clinical excellence without safety excellence is incomplete. Hashtag nurses, your double checks, your escalation calls, doctor, this looks unusual, are life-saving. Your incident reports and near-miss reports are the raw material of improvement. Your documentation is the story of the patient's journey. Nurses are the safety eyes and ears of Panacea. Hashtag technicians, housekeeping, front office technicians who catch labeling issues, prevent wrong reports and wrong treatments. Housekeeping that reports wet floors, broken rails, loose wires are preventing falls and injuries. Front office that tracks waiting time and patient complaints helps us redesign services. If you see something unsafe and you speak, you are doing NABH 6. Title doesn't matter. Hashtag culture bank alta gently but firmly. In the end, tools and policies are only as strong as our culture. 5 behaviors I want at Panacea. 1. We speak up politely, irrespective of hierarchy. Junior nurse to consultant. Sir, can we please reconfirm the patient ID? 2. We thank, not punish, the reporter. Thank you for reporting this. Now we can fix the system. 3. We stay curious, not defensive. We ask, how did this happen? Before we ask who did this. 4. We share learning quickly. Short, non-blaming learning notes after serious events. 5. We do not say kalta hai for safety. For safety, we only say yeah, theek karna hai padega. One line I strongly believe in, today's kalta hai can become tomorrow's court case and the day after tomorrow's obituary. That is why we choose NABH 6 over kalta hai. Hashtag closing as Dr. Madhav Sharan call to action. So let me close with 3 simple takeaways. 1. NABH 6 equals measure, learn, improve. 2. Incident reporting is bravery, not betrayal. 3. Small, honest PDSA cycles create a safer Panacea for every patient. Now I request each of you to choose one small commitment. A doctor, I will review every serious case once for process gaps, not just clinical decisions. A nurse, I will never give a high alert drug without a proper double check. A technician, I will never ignore a labeling doubt. Housekeeping, I will report every unsafe condition immediately. At Panacea, I want this to be our shared line. Patient care is our duty. Patient safety is our identity. NABH 6 is the roadmap for that identity. Thank you. I'm happy to hear your experiences and ideas on how we can make Panacea even safer. If you want, I can now turn this into a precise slide-wise outline with by Dr. Madhav Sharan branding and interaction cues, sources,